released a new version of the book. Could you talk about
Yes,
some
yes.
of the changes that some of the
Yeah,
Histamine
so
parts?
there's a lot of conversation about the anti-nutrients. We talk more about lectins, about histamines, oxalates. So I cover that in the new book. There's so much more information about fasting in the
Mm,
fasting strategies. We talk about time-restricted feeding, intermittent fasting, and periodic fast. We also talk about calorie-restricted eating. The research has come further with the electrical stimulation of muscles. So I review that research and the advances there. Of course, we talk about the microbiome, epigenetics, and then I let people know about the positive research that we've done, what we found, and the study that we've just finished, written up, and is under review. So
yeah.
I'm hopeful that we'll be able to get that out into publication sometime in 2021.
Okay, excellent. Yeah, that would be great. So on that list, so one thing I'd like to talk a little bit about. So we'll talk about intermittent fasting a bit later, but histamines. So you're saying kind of histamine. Uh,
Well,
yeah,
there are some people
yeah,
who have difficulty with histamines.
right.
And so if they cannot metabolize the histamines well,
Mm,
they may have headaches, they may have a rash, they may have muscle aches and fatigue. And mast cell activation syndrome is a
mm,
more severe symptomatic version of that. So we discuss the types of symptoms and some of the strategies to sort out, is this a problem for you? And if that is the case, what your options are.
right. Okay, excellent. Thank you. That would be interesting. Yeah, I guess the thing is, a lot of healthy foods seem to be high histamine. So it's like avocados and walnuts, and so it's
Correct, correct.
difficult.
I do discuss that we're all unique. So you have a unique microbiome, you
Mm,
have a unique set of your own DNA instructions from mom and dad. So although I can write a very nice treatise for what are great foods for the public, because of your unique DNA and microbiome, a food ingredient that I hail as just superb, your gut microbiome may say, nope, this is not going to work for you, and you're going to have abdominal complaints, whether it be bloating or pain or diarrhea. And so I want people to think of the Wahls protocol as this is where you start,
mm,
and then you need to listen to your body. If you feel like there's a specific food, let's say oysters, every time you have oysters, you have diarrhea or belly pain, then for whatever reason, oysters are not going to be working for you.
right. Do you see this kind of difference in your patient?
Occasionally, we'll have folks who find that they cannot handle 3 cups of greens every day, but
Right.
they do well if they back it down to a cup of greens every day. Occasionally, I have someone who has intolerance to sulfur vegetables. They don't do at all well with garlic, but they do fine with the cabbage family. Or maybe they struggle with all of the onion and garlic family, but do fine with mushrooms. So people may have a specific food group that they do less well with. And so we have to help them identify what are alternatives to that food group.
Right. So that's interesting because my wife has some intolerances. So how do you determine the intolerance if somebody has an intolerance?
Well, so there are a couple ways of doing that. I prefer doing the elimination diet.
Right.
So we take the foods out and then reintroduce them one at a time
Yeah.
and assess for your response. And because we're doing it in the body,
Mm,
I think that's the most specific to really know what foods are good for you and what foods are not. And that is the gold standard. But it's a bit of work both for the patient and the clinician to sort that out. The other option is to do food sensitivity testing, but there are false positives and false negatives.
mm,
So that's as well. But there are some food sensitivity tests.
right. So just specifically for food sensitivity, the IgG, the immunoglobulin
So the
test?
IgE tests for anaphylaxis when that would narrow your airway, lead to septic shock, and that's a much more acute response. Food sensitivities look at IgG, and that's a much slower response. It's not really an allergy. And then there are cell tests, such as ALCAT, that look at how the whole cell responds. And then you're looking for cells that basically explode in response to that food protein. It's different parts of the immune system for each test.
Right. Okay. Yes. Excellent. Thank you. So your diet, the diet you have is very whole food based, but you
Yes.
were taking supplements before. So do you?
Yeah. So supplements can certainly still be helpful.
Right.
I have some suggestions for everyone. Vitamin D turns out it really acts more like a hormone than a vitamin. When sunlight hits our skin, we begin the process of making vitamin D, which goes to your kidneys and your livers to be further activated, where it interacts with your immune cells, your brain cells, and nearly every organ system. It's a vital part of our health. And your ancestral mother and father were out in the sunlight 24/7, 365. So we had lots of sunlight, made lots of vitamin D, and our skin would break it down if it gets to be too high. So you really can't overdose on sunlight in terms of vitamin D. If you take supplements, because you're not out in sunlight, and most of us, we don't live and work outside anymore. You and I work probably inside. We may go out some. Our skin physicians or dermatologists have identified that sunlight leads to rapid aging of the skin, and it perhaps increases the risk of skin cancers. And so they advise us to put sunblock on to reduce the risk of skin cancer. But it also reduces the ability to make vitamin D, contributing to vitamin D deficiency across the country. And we know that if your vitamin D is low, you're at a higher rate of preterm labor, infertility, anxiety, depression, heart disease, diabetes, autoimmunity, and cancer. So we either need to get outside and get a tan or take vitamin D supplements. And vitamin D, we also know that the studies that do look at just giving vitamin D haven't really changed the outcomes very much, because it's probably you need vitamin D plus vitamin A plus magnesium plus calcium plus, as I said, magnesium plus sleep plus exercise plus gravity. So it's really a more comprehensive approach. I do want everyone to know their vitamin D, get their vitamin D addressed, but then I want you to do strength training and to have this very comprehensive diet.
Right. Thank you all for watching. I hope that you found the video informative. Please do hit the thumbs up button, subscribe to our channel, and hit the bell button for new video release notifications. It encourages us to continue to create more videos about anti-aging and extending healthy lifespan. Thank you so much for your kind support. I wish you all well and will speak to you again soon.